Hello, I'm Dr. Sanjay Mahajan. I'm a senior consultant physician and intensivist at Kailash Hospital Noida, Sector 27. Today I take this opportunity on 1st September to tell you that 1st to 30th September is actually recognized as the World Sepsis Month, and 13th September is considered as a World Sepsis Day. Now, what is the importance of sepsis and keeping a month, earmarked for such a thing? Let me tell you what is sepsis at the outset. Sepsis is basically body's response to infection, and once you have an infection, the body responds to the infection by immunity. And what happens is, usually the immune mechanism starts destroying the body's natural organs also, and therefore there's an inflammation, and the patient becomes toxic, and it might cause actually death. It might prove fatal. So it is important that we recognize sepsis and try to prevent it also. Now, how do we recognize sepsis? Sepsis is basically infection occurring primarily in the lung, as pneumonia, in the urinary tract as a UTI, in the abdomen, in the skin, in the brain as meningitis. All this could actually flare up to a full-blown sepsis. More common causes nowadays is the seasonal flu, dengue and malaria. We should not be forgetting them. So once we know what is the cause of sepsis, now let us find out what is the signs of sepsis. If a person has he's high fever and patient is shivering a lot, and patient passes less of urine, patient is having a feeling of impending death. He feels that I'm not feeling well and I might die, and there is a mottled skin. These actually mean that the patient is going into sepsis. Once we've identified sepsis, it is imperative that we meet the doctor and try to give appropriate antibiotics. Self-use of antibiotics should be absolutely prevented, not to be given, because it leads to unnecessary bacterial resistance. So if we have been treated on time, we are into the hospital on time, every minute of sepsis actually counts. The earlier we start treatment, the better we can prevent the death. It is such a major issue in present day that you will not believe it, that by the time you have watched this video, at least 55 people have already died of sepsis in the world. So considering the magnitude of the problem, we should be aware of sepsis, and prevention of sepsis can be by identification. First of all, being aware of what sepsis is, identifying sepsis, getting to the hospital as soon as possible if you suspect a sepsis, and finally keeping our environment clean, and using various vaccines which actually prevent infection. Hence, we've kept, and the world has actually allocated a full month into the awareness of sepsis, whereby once we are aware of this problem, we could actually fight sepsis and save lives. Thank you.